Consumer bankruptcy, a fresh start. All right, so my man Savas, everyone's favorite Greek on the channel. I think, is he from Crete? I can't remember, but I've emailed him back and forth about Crete because Crete sounds like my kind of people. Anyway, he had sent me this article from Money Mag's. Where is it? Let me see if I can't find it. This article about healthcare expenses, retirement average $67,000 even with Medicare coverage. The author is Carolus Arapakis, which I said, Savas, is that a Greek homeboy? Anyway, so I was looking up this article because I at the end of the day, I don't have any qualm. I haven't looked into his. I've looked at this article. I haven't looked into the Carolus's writings yet. But I was like, all right, well, let's just say it costs you $67,000 over the course of retirement. That's not cheap, but I'm like, what? You're not gonna retire because $67,000? I take issue with that, even such. But I'm like, huh? I'm going to keep working because I can't retire because of $67,000. Anyway, so I was reading that a little bit, and I came across Carolus's paper from the good folks at Boston College Center for Retirement Research. Here's the paper, the brief from his paper, Dateline, August 22. And I'm reading the introduction. The first thing I came across was healthcare spending rises with ages and income, posing a potentially substantial burden for many retirees. Previous research has linked high retiree health expenses to extreme outcomes such as bankruptcy. And I know that that's a fake article because Elizabeth Warren did it back in the early 2000s, and I've destroyed that article 1,000. And even Elizabeth Warren, look, man, it's so freaking stupid. It's absolutely embarrassing that people fell for it, but they do, as this guy did here. Anyway, and then he goes, and has identified precautionary behaviors by some retirees to mitigate risk, such as bankruptcy. So he cited this article here, number 3. So I'm coming down here and I'm looking at number 3. Bankruptcy has been cited as a way to self-insure against high, uncertain, out-of-pocket health spending. And we got this guy, Livshits. It's like, geez, imagine going through your life with the name Livshits. McGee and Tarot. Healthcare spending, let's see. So I looked up this article by Livshits. It's fun to say. Consumer bankruptcy. A fresh start. Okay, well, his first name's Igor, so I don't know what nationality that is, but in America, I've never met a guy. I've met Lip Schultz, but never a Liv Shits, if that makes sense. Anyway, so I'm reading this a little bit, and he talks about, we refer to the fresh start. You filed Chapter 7, and we'll just go into what Chapter 7 means here real quick. Hold on just a second. Chapter 7 to Chapter 13. Chapters 70% of consumer bankruptcies are filed under Chapter 7. All unsecured debt is discharged in exchange for a non-collateralized assets above a certain exemption level. Debtors are not obliged, however, to use future income to repay debt. So you're basically, look, I'm getting off this. I don't owe you nothing. You're going to take my assets above a certain exemption level, and we're going on our separate ways. Debtors must wait at least 6 years to file another Chapter 7. And then you got Elizabeth Warren. Isn't that interesting? Chapter 13 permits debtors to keep their assets in exchange for a promise to repay part of their debt over 3 to 5 years. To qualify, you must have a regular income and secured or unsecured debts of less than secured debts of less than $800,000. I guess which 270 would be unsecured. Anyway. So let's check this out. On average, bankrupt households are 30 to 50% poorer than the average household. Well, it makes sense because they're getting rid of some of their assets to get rid of the debt. That doesn't shock me in the least. Filings first increase then decrease with age. The main reported cause of bankruptcies is shocks to income and expenses. Elizabeth Warren report that 67 in the 2000. Elizabeth Warren reported 67.5% of filers claimed the main cause of their bankruptcy was a job loss, while 22.1% cited family issues such as divorce, and 19.3% blamed medical expenses. Now, multiple responses were permitted. Other studies find an even larger role for medical expenses. Again, Elizabeth Warren. It's the same. I mean, it's not other studies. It's the same study. Sullivan, Warren, and Westbrook, 2000, report that 67.5% of filers claim that the main cause of bankruptcy was job loss, while other studies report that an even larger role for medical expenses. Elizabeth Warren, Sullivan, and Jacoby in 2000. I mean, what? So, Sullivan, Warren, the only difference, Sullivan, Warren, we got Jacoby versus Westbrook. I mean, what? So in this study, Elizabeth Warren and Sullivan are saying it's 46% because of medical reasons or a substantial medical debt. I mean, make up your mind. Anyway, be that as it may. The point being is, what's wrong with using the bankruptcy system? If your concern is that you're going to have this shock of a medical expense and you can't pay that shock of a medical expense, that's what the bankruptcy system is for. I'm not encouraging you to go bankrupt because you spent too much money on your credit card. But there is a system in the United States called bankruptcy that is there to use if you can't pay your bills. And if one of the reasons you can't pay your bills is because of a medical care shock, and it's not the predominant cause of bankruptcy, but it can be a cause. It can be a significant cause. And don't feel guilty about it. You not know how these hospitals are run? Do you think they're nonprofit? The freaking the Catholic nuns are in there? No, these are freaking capital. They're not even capitalists. They're fascistic profit-making centers for a lot of cutthroat CEOs and executives. That's just a fact. Now, I'll just share with you my story again. Chloe, my second daughter, had to spend the first month of her life at the University of Virginia Neonatal Intensive Care Unit, NICU. She had ventricular tachycardia. Very few, in fact, everyone always thinks, she didn't have VTAC. Yes, she did. She had VTAC. And the cardiologist said, no, she had SVT. Nope, she had VTAC. Anyway, long story short. So we got bills, we got $30,000, $40,000 when all was said and done from the hospital, UVA. All right. I was at a party one night, a get-together with some Republicans. I think it was like the 2004 vote or something. I can't remember. But it was to run up to the 2004 election. So I was at some kind of Republican get-together in Harrisonburg, Virginia. And I was talking to this guy who happened to be a up-and-coming politician in the western part of Virginia. And he actually ended up winning his seat. Not a bad guy. I wouldn't, I don't think he's evil. I wouldn't trust him but he's not a bad guy. He's a politician, man. There's no other way around it. He's climbing the ladder. He also had a kid that was at the UVA. I can't remember if it was a NICU. But anyway, he also had to use Ronald McDonald House and all that. He also had similar bills than I did. But his were waived by the University of Virginia. They waived them by their accounting office or whatever. Even though he had much more income than I had, much more net worth than I had. You know what I'm saying? But they waived his, they did not waive mine. And the only thing that could possibly attribute to that was he's a politician. I'm not. Kind of like going back to Michael Obama's work in the hospital in Chicago. Michael had no hospital experience whatsoever. But I'm talking about Michelle Obama. It's a joke, dude. Relax. People call Michelle Obama Michael. I just always got chuckled at. I don't care. I just find it funny because it's fun to make fun of the people get all like, oh my goodness, just relax, dude. You call Orange Man bad, I call Michael Obama. Who cares? Anyway, just relax. You get that stick out of your butt and learn a joke. Anyway, so Michelle Obama gets paid a $350,000 a year gig, and this is like in the late 90s, early 2000s when her husband became state senator in Chicago to work in the hospital, some hospital in Chicago. She had no experience whatsoever. Hospital administration. It's just all political, man. So let's just say you're Grandma Jones and Grandpa Jones. You retired. You're 82 years old. You got hit with a sudden medical bill. You're like, I can't pay it. That's what the bankruptcy is there for, man. The system is there for. Again, I'm not saying exploit it, use it. I'm just saying that's what it's there for. Do you not think you've been paying taxes left and right? Do you not think these hospitals are political animals? Do you not think the hospitals get bailouts? Do you not think the hospitals also have certain provisions and ability to make more money if they label certain things a certain thing? You know what I'm saying? Don't you be the one holding the wet bag. It was going to keep you between you and retirement, man. That doesn't make it. If this is the one thing that's keeping you between you and retirement, is you're worried about this big shock. Don't you be the one holding the wet bag. Now, can you keep your house? I don't know. In chapter 7, I don't know. You have to look at. I don't know. But if that's it. That's the only thing keeping you work is because you're like, oh my goodness, what if I have to have a big medical shock? Something to think about, and obviously other people have thought about it as well. In fact, this guy's article says, he cites this study that says Fresh Start actually improved where you can go bankruptcy. The Fresh Start, debtors can discharge their debt via bankruptcy and continue their lives free of their existing debt. It actually can be used to increase consumer welfare. Now, another lady says it doesn't. There's a guy in here, which I kind of chuckled at. It can help consumer bankruptcy laws can help consumers smooth their consumption across states at the cost of distorting their ability to smooth over time. I don't know what that means. But there's a guy in here who did not like it. Right here. He finds eliminating consumer bankruptcy improves welfare. I don't buy that for 2 seconds. You got no way to discharge debts that improves welfare? No. These people say find that eliminating bankruptcy reduces welfare. Yeah, I completely agree. All right. Anyway, what are your thoughts, man? It's okay. It's okay. We'll see you.